Hey guys, my name is Katelyn, and today I would like to talk to you about assisted suicide. Have you ever thought of the impact it does to healthcare practitioners, or wondered what the criteria is like to be eligible? What about the ethical issues of assisting someone in suicide who is very alert but suffering so much pain? How does one grieve such a traumatic event? Have you ever thought of assisted suicide and wondered if it's available to you or someone you love dearly? You could be eligible if you meet the following requirements. You must be 18 years of age or older, be eligible for publicly funded healthcare in Canada, your health is consistently declining with no way to rectify the problem, have something that is severe and cannot be cured, natural death is in the foreseen future, able to make health related decisions. Okay, so you have thought of when and how you would like to pass, but have you ever wondered or thought of where? Assisted suicide can take place in the hospital, the comfort of your own home, a hospice, or even a long term care home. What about the ethical issues? Nurses must put all ethical issues behind them when dealing with assisted suicide. The best place for a nurse to start is making sure they are very thorough with their patients and exploring all possibilities on making them have some quality of life. And if all else fails, provide them with their wish of assisted suicide. If they cannot go through with it, they must refer them to a physician who can. What are the main reasons one would wish death upon themselves any sooner? Well, there's two big ones. The number one causing is cancer. Number two is neurological disorders like amyotrophic lateral sclerosis. How does one grieve a death after a death? Nurses go through patient deaths over and over again, sometimes multiple times in a week. Natural deaths leave a great deal of heartache on everyone involved, but they can see the patient deteriorate over time, and it gives the parties some time to mentally prepare. But how does one cope with seeing a patient engage in a conversation 1 minute, and then the next minute they are gone? This can be the reality of assisted suicide. There is very little research done on the long term effects of these traumatic events on nurses, so it's very important to be aware of post traumatic stress disorder within patients, their family members, as well as fellow coworkers. In conclusion, nurses and other healthcare providers need to have a lot of support from their family, their peers, and other coworkers. There should also be more education in mental health to look for the signs of depression, anxiety, and not coping well within themselves and each others. Assisted suicide will leave a long term impact on nurses, and it takes a very strong type of person in order to manage these different emotions. Thank you very much for watching and listening to my view of assisted suicide. I hope you learned something. Take care.